Good evening, ladies and gentlemen. Welcome back to Tips from Back to Health. My name is Dr. Goynatsky, and I'm a treating doctor in one of the facilities. Today, the question of the week is going to be, what are the precautions or what do not to do after hip replacement procedure? And there are a specific amount of things that all of the patients are not allowed to do right after the surgery and within the whole rehabilitation procedure. And there are 3 or 4 main things which are not to move or not to place your hip in a certain position that can compromise or can delay your healing process. One of those things are you have to make sure that you never put your hip, or in other words, you should not sit at any low surfaces. Let's pretend that you're surgical or you had your hip replacement on the left side, so you do not sit on any surfaces where your knees are above your hips. Most of the time, the position, and this is the perfect position of your hips, all over. So 90 degrees, where your knees are slightly below or at the same level of your hip. Okay? Number 2, you have to make sure that you do not bend too deep, especially in those cases where you had a procedure done using their posterior approach, where the cut or the incision has been on the buttock side of your left hip. So number 1, do not sit in the low surfaces where your knee is positioned above your hip. Number 2, do not bend down, especially when you do your house cleaning or you need to pick up something from the floor. Everything should go from your hips, squat down, keep something close to your body. At the same time, you'll be able to preserve your back as well. So don't do this, squat. And number 3, do not cross your hips. Okay, so basically your hip, again, pretend that you had a surgery on your left side, do not cross your hips. In what situation it might happen? Whenever you, let's say, lay down in the bed. So make sure that you do not cross your legs extremely, okay? And so let's repeat. Number 1, do not sit in low chairs or beds. Make sure that or toilets, make sure if at some point you have a high toilet seats, make sure that you have maybe a raised toilet seats, or you have sometimes you might have some like toilet frames where there is a couple of inches above the toilet. So make sure that your knees are not situated higher than your hips. Number 2, do not bend down. And number 3, do not cross your legs. And one of the most common questions that usually patients with hip replacement ask me right after the surgery: oh, will I feel better, or when the pain will go away? And always I try to tell them, try to think about how did you feel before the surgery, and how do you feel now? And 95% of the patients usually tells me, of course I feel much better. That's why my suggestion, relax, make sure that you follow the instructions, make sure that you follow the precautions. Thank you very much, guys, for listening. I hope that this video about the hip replacement precautions, or what not to do after those type of surgeries, that you follow those guidelines. If you have any more questions, please ask us after this video, and we'll try to answer them as soon as possible. Please share all this information with your friends, with your loved ones, and come back to health, and we definitely will bring you back to health.